If you've followed me for a while, you know that I absolutely love infrared saunas, right? But what if you don't have an infrared sauna available to you? Or what if there's no room in your apartment for a sauna? Well, I have the perfect solution for you. Infrared sauna mat. So you can just come home and while you're watching Netflix, you can just turn it on and have access to an infrared sauna right in the comfort of your own home. I use mine all year long, but it is especially cozy in these winter months that are coming up. So if you're interested in finding out more and getting a little discount with your infrared sauna mat, I mean, what better gift do you want to give yourself with the little detoxification that you can do every night if you want? Check out the link below to learn more. Welcome to the Sacred Medicine Podcast. My name is Margaret Romero. I'm a Columbia-trained functional medicine nurse practitioner, and here I uncover the truth behind chronic illness so that you can finally heal. I'm a women's health and hormone expert and love empowering women to finally live their life fully and powerfully through optimal health. This is the Sacred Medicine Podcast. You are listening to the Sacred Medicine Podcast. I am your host, Margaret Romero. And can I just tell you, it was a gorgeous, gorgeous fall day here today in New York. I love this weather, but it's starting to get cold. And you guys know how much I dislike the cold. So I think this year, I'm actually going to be headed to Florida next week for a conference, but I'm also going to be checking out the west coast of Florida just to see the vibe, you know, in case I don't know, I'm really planning on spending my winters in Florida. So just a little update on my life. Today's guest is Dr. Tabatha Barber. Oh my goodness. She is a functional medicine gynecologist, and we are talking all about hormones and birth control pills and how, did you know that birth control pills actually contribute to leaky gut syndrome, permeability issues? So we are also talking about the thyroid and toxic burdens on the thyroid. So this is a very comprehensive talk today about so many things. We just touched on so many women's health issues today and how birth control is just a Band-Aid and so on and so forth. There's just so many nuggets in here. So without further ado, on to the show. We are back for another week of the Sacred Medicine Podcast. I am your host, Margaret Romero, and today we have a new guest, Dr. Tabatha Barber, and we are talking all about hormones today. Tabatha, thank you so much for being here.
Thank you for having me. I'm so excited. This is such an important topic for all women.
Absolutely. So today, I mean, I love hormones. I have been working with women with hormone issues and imbalances for a long time. So let's start off, actually. You are a functional medicine gynecologist. Why don't you tell us the biggest differences between conventional medicine and functional medicine when it comes to gynecology?
Yeah, so this was really eye-opening for me. I was practicing, for a decade in my conventional OBGYN practice. I was your typical obstetrician. I was very sleep deprived because I was up delivering babies all night, doing surgeries all day, and eating whatever was left in the break room, So I was overstressed, eating garbage, sleep deprived, and my own health was failing me. Meanwhile, I'm being forced to see patients every 15 minutes, crank them out as much as you can, and not really addressing their issues. And I would realize that women would come to me over and over, month after month, with the same complaints because the birth control wasn't fixing it, or new complaints from, the birth control pill or the IUD or whatever else conventional medicine had to offer. So I was always, doing this Band-Aid approach of, well, what symptom can I get rid of today in 15 minutes? And when I finally broke my health and had, burned out and broken down is when I realized that there was another way. So I would love to just share, like, I was out one night with my girlfriends and I was on my period. I had put a tampon in before I left the house. And I kid you not, a half an hour later, we're all standing outside having a good old time. And I just felt a gush. And I put my hand down and it was just covered in blood. And my friends laughed at me because here I am, the gynecologist, and I have crazy heavy periods and I couldn't manage it. And this kept going on and getting worse because of, my life. And what I realized was I couldn't take the pill. It gave me migraines. The IUD made me almost suicidal. I couldn't have an ablation because the scar from my C-sections was too thin on my uterus. And so the last resort was a hysterectomy. And that really woke me up, wait, what? You want to cut my uterus out? I do it all the time to women. But when it came to me, that really stopped me dead in my tracks. And I realized, wow, women must be really scared and really trusting to go through what they go through in their gynecologists. And they don't seek out other solutions because they don't realize they're there. The gynecologist doesn't offer them. I didn't even know any other solutions existed. So when I started studying functional medicine and I realized that you got to figure out the root cause of why your hormones are imbalanced and causing these crazy heavy periods and everything else you're experiencing and fix that, you don't have to keep putting new Band-Aids on because the hemorrhage stops, pun intended,
Right.
So it really opened my eyes and I have never looked back. It completely changed the way I practice. I no longer perform surgery because I feel like I don't need to. And I heal more women than I ever did in the past. So I would love for us to talk about some root causes of why women are having these GYN conditions and help women realize that you don't have to do what your doctor's recommending. There are other options. They're just not trained in what they are. So you need to seek out new information and, listen to podcasts like yours to find those other solutions.
I love that. And so what ended up happening with your periods, with your heavy periods?
So, it was a vein situation. She told me, I'd have incisions on my stomach for the hysterectomy. And that was the only part of my body that I still liked at that point. And so the idea of having surgery, I was like, no. Looking back, I'm glad I had that vein moment because it got me to stop and find a new answer. But what I found out was I needed to seriously clean up my diet. I needed to love on my liver. I needed to fix my gut issues. And when I did those things, my periods went back to normal. Now they're, 3 or 4 days. One day is, a little bit heavy. There's no accidents. It's not painful. It's like a night and day difference. And that is all without any medications or surgery.
Isn't that amazing? I know. I feel like when it comes to gynecology, it's birth control or surgery. And those are the two biggest things. Let's just rip it out and then you'll be fine. I remember I had a patient of mine a long time ago. She had endometriosis and she was in constant pain. So they said, okay, you know what? We're just going to do a hysterectomy and that should be the end of it. They did the hysterectomy and she still has the pain.
Right.
And it hasn't gone away. I
Yeah,
think she lives somewhere else now, but we do not, she went all in with conventional medicine when it came to that. So
Mm.
unfortunately.
Well, yeah, because it's really ingrained in you that that is the smart, safe way to go. And the doctors that you see don't offer any other solutions. And unfortunately, at the root of endometriosis is chronic inflammation and hormone imbalance. And it's not
Yes.
because your uterus doesn't like you and it doesn't want to behave, it's because it's being stimulated and dealing with something that you're not fixing. And so we just go about it all the wrong way. We meaning conventional gynecologists. And luckily, there is finally research coming out that is really helping, the medical system see that it's an inflammatory based condition. It's not just from your uterus. It's a systemic issue. It's very much driven by gut dysbiosis and gut issues. And so I think someday we'll get to the point where maybe conventional medicine will catch up and realize that there's more than just birth control pills and surgery. But for now, you really do want to see a functional medicine practitioner who understands the root cause of endometriosis or fibroids or ovarian cysts, things like that, because it's not that you need birth control pills. Birth control pills are synthetic hormones that suppress your own hormone production. So normally we have this beautiful communication from your brain to your ovaries called the HPO axis, the hypothalamic pituitary ovarian axis. And they talk to each other constantly. They're constantly sending signals with their hormone production. And the birth control pill literally shuts off that communication. That is why many women don't have a period once they come off of that pill, because the period you were having was fake. It wasn't real. It wasn't you cycling your hormones. It was those synthetic hormones causing the lining inside your uterus to grow and shed. So it's just another Band-Aid approach. And now we're understanding that birth control pills contribute to leaky gut and other issues long term. So it's really not the best solution for women.
Oh gosh, no, there's so many issues with it. Talking about leaky gut, why don't we go into that and how hormones are impacted by gut issues?
Yeah, so synthetic hormones like birth control pills, Premarin, Prempro, those all cause leaky gut or increased intestinal permeability. So we have all these little, gap junctions between the cells in our intestines. They're supposed to act like toll booths and open up and let the good amino acids in and the vitamins and then close and keep out bad bacteria, the pesticides, all that undigested food proteins. But things break those gap junctions, and synthetic hormones are a huge one. But also hormone shifts like puberty, pregnancy, and menopause can cause leaky gut as well. So women are very susceptible to this as compared to men. And I truly believe that's why we see so much more autoimmune disease in women, is because our gut lining is more susceptible to having impermeabilities. So it's really important that you have the right bacteria living in your gut, that you have a good, strong immune system, your IgA system in your gut, as they're like the frontline guys who protect from things from getting in. And, if you don't have that imbalance downstream, you're going to get hormone imbalance, because the gut helps you absorb your vitamins and minerals. It also makes vitamins. It helps make our neurotransmitters, which keep us calm and feeling good. It helps us absorb healthy fats. Cholesterol from healthy fats are the backbone to hormone production. So if you probably remember this, the low-fat diet of the 90s, where we all ate low-fat, no-fat. It wreaked havoc on our hormones, because that is the backbone for hormone production. We cannot make progesterone, estrogen, testosterone, DHEA, none of it without cholesterol. And so, the food industry, the medical system, they really failed us on that one. We're now understanding we need healthy fats in our diet every single day for proper hormone production. I mean, it used to be when that was the craze, then you started seeing insulin resistance, which drove the dysfunction further. But so many women's hormones were impacted because they couldn't make their hormones the way they were supposed to. It was pretty crazy.
Wow. So what about perimenopause and menopause is causing the issue with the leaky gut? Is it the fluctuation? Is it the decrease? Is it the decline?
Yeah, so it's the decline in estrogen and progesterone. They think that it's estrogen more than anything. Estrogen receptors are all over our body. They are in our brain, they're in our cardiovascular system, in our gut, in our bones, everywhere. And so once our estrogen levels start to decline, that really affects the gut's ability to function and stay healthy and protected. So that's just one piece of it. So you're going to see shifts every time women go through changes. And if they don't have regular periods, say you have polycystic ovarian syndrome and you're only having 3 or 4 periods a year, then your gut is really susceptible to being leaky or having increased intestinal permeability because it doesn't have that protection.
Okay. So the fact that women's hormones start to decline as they get older leaves them susceptible to permeability issues, leading to all kinds of things. So what else? Because most people, they'll have these imbalances in their hormones, and then they go straight for trying to get put on maybe more hormones or testosterone or what have you. And so tell us a little bit more about that, like that, how that may not be such a good idea.
So it's not so bad to get yourself a quick win. I mean, say your progesterone is super low or your testosterone's in the tank. Taking hormone replacement to get those levels back up to normal is going to help you feel better in the short term. But because now you have leaky gut that you haven't fixed, you have probably developed food sensitivities, or you have possibly turned on autoimmune disease if you have the genetic propensity. And so all of that inflammation and stuff is going on in the background that you still haven't addressed. And so I see this all of the time, people chasing their hormone levels. They keep having to add more or switch it around because they're not fixing the root cause of the issue. And so their hormones are trying to be in balance, but because you aren't fixing the problem, it's like, say you plug a drain in a sink, you turn on the water and you let the water run over the sink. You're out there mopping the floor, trying to mop up all the water, but you never turn off the water or open the drain. And so it's never really going to get fixed, right? So that's how I see it with hormones. Like I prescribe hormones all the time, but that is not the only thing we need to do. We need to heal your gut. We need to address your autoimmune conditions. We need to address your food sensitivities that you've developed from your leaky gut. Like so many other things now have to be dealt with. And that is a big missing piece with like these quick hormone clinics that, people go to and such, where they feel good.
Right.
Couple months, but it's not sustainable because that wasn't the problem. It was actually the result was your hormone imbalance.
I would love your thoughts around the pellets, hormone pellets.
Yeah, so I actually prescribe hormone pellets in certain situations. I think that they are overused and they are dosed too high for a lot of people. I think that it's smart to be conservative and use it in the right patient. So usually, postmenopausal women who have very low testosterone, they have difficulty gaining any muscle mass, they have difficulty with brain fog, motivation, they would probably benefit from a testosterone pellet. Or if you're on long-term estrogen, say you're like 55 years old, you know you've been on an estrogen patch for a couple years, you know you want to continue it, and getting a pellet is a nice, easy route so that you don't have to use the patch all the time. But it's dosed too high in a lot of people to the point where it stimulates the endometrium, and then you're trying to create new problems, or it's not balanced with progesterone. So, you want to make sure you're going to the right kind of provider who knows how to do this. And I will say there is a company out there across the country who opens clinics for HRT pellets, and they really, I feel that they dose too high. So you got to be careful.
Yes.
So it sucks because then hormone pellets get a bad rap altogether, and I just think it's not for everybody. It's for the right person. I don't think 35-year-olds need it. I don't think a lot of women need it, but some, it works really well. So I like to have that option, but it's not for everybody.
So I wanted to just share a quick story. So I had someone that I knew. She was feeling really tired and just so lethargic. She went to the doctor and they were like, "Oh, you have low testosterone. So let's go ahead and give you some pellets." So they gave her testosterone pellets and she was like, "Yeah, I felt, the libido was good and all of that, but I don't know, something's up. I just not feeling that much better." Come to find out that she had colon cancer, which was the reason for her fatigue. So the thing is that you cannot look at one thing and one number and say, this is it. I mean, if they did a CBC, they may have been able to catch it. If they would have asked more questions about her anemia or checked a CBC and seen that her hemoglobin was, I think, 6, they would have not have automatically just put her on testosterone. So,
that is such an important story. I hope everybody realizes this is the key. You need the full picture when we are talking about intervention. We need the full picture of what's going on. I always ask myself, why is her testosterone low? Because testosterone just isn't normally low. There's a reason for it. It's usually too much adrenal stress because that's where a lot of our testosterone comes from. And so asking the why and figuring that out is key. And I will tell you, I do stool testing on every patient because it almost always starts in the gut. And if they would have done a stool test, they would have seen an elevated calprotectin level. They would have seen blood.
Yes.
And that kind of stuff would not get missed. It's not acceptable in this day and age. It just is not. We're not different systems in different silos. We're a connected, system of systems that's all interacting together. And it's so important to get the full picture. I mean, my patients, get picked on when they go to the lab because I draw so many labs. They're like, why are you getting so many done? And I
love blood work.
Yes, because you can't put a picture together with 5 puzzle pieces. You need all the pieces to see the actual picture, And so I love to test and just not guess.
Oh yeah, definitely. And just going back, because I'm sure some women have this same question in their head. So when you said that, once there's a decline in your estrogen, there is higher probability that you may have permeability issues. So is that for every single woman, or does other risk factors make a woman more susceptible to this type of permeability with a decline in estrogen?
That's a great question. So the the endothelial cells that line the gut, luckily, they regenerate every 24 to 48 hours. So you can build a new gut lining every day. The problem comes in with women who are taking chronic NSAIDs like Motrin and Advil for pains and different things, or on antibiotics, or smokers, or eating the standard American diet, which is full of pesticides and other toxins. So that repeated, assault to the gut lining is how you get leaky gut. It's not just from the hormone shift. It's not just from the poor diet every once in a while. It's what you're doing on the daily, on a regular basis. If that gut lining is constantly being assaulted and can never allow to heal properly, then you're going to develop leaky gut. So women who, are eating clean, whole foods, they're trying to eat organic, they're managing their stress, they're getting their sleep, they're on probiotics, they're probably going to transition through and not get leaky gut. But for the majority of Americans, we're at risk. We really are.
All right. Amazing. Yes, I can see that for sure. I mean, and like, there's just so many people that just like pop Tylenols, pop Advil for this joint pain or that pain or lower back pain, and think they're sort of, what's the big deal? It's over the counter, but they definitely cause damage. And obviously, excessive amounts of Tylenol is definitely not good for you or your liver. And certainly, things like Advil and Motrin can sometimes affect the kidneys. So I think that there's, I mean, so many people, like, who isn't even smoker or eats fast foods now and then, pops Tylenol, Advil. I feel like this is like the norm. It's like the majority of the population do these things,
Oh my gosh. I had a patient recently who came to me for a new diagnosis of a Hashimoto's, and she was questioning her doctor's treatment plan. Her doctor wanted to do 800 milligrams of Motrin 3 times a day for 3 months. I said, you're going to have a hole in your stomach by that time, and to calm down the attack on her thyroid. I said,
that's insane.
Malpractice. Like, that is unacceptable.
What negligence.
Yeah. So thank God she had enough sense to question that and say, that doesn't sound like safe. And it wasn't. So we need to figure out why your immune system is so inflamed and calm that down, as opposed to trying to block that immune response with NSAIDs. And oh my goodness, there's so many more natural alternatives than NSAIDs that aren't going to eat a hole in your gut like Motrin will. So if that kind of stuff happens, like, you need to seek other answers. I always say, like, question what your doctor is recommending, because the way we were taught in medical school was already antiquated. You come out and you practice the same way for like 20 to 40 years, and you really don't change a lot of how you practice. Most physicians, unfortunately, don't evolve with the times. You know what I mean? And so it really is on the patient to question and research, and seek other answers.
The other thing I was going to mention was, the fact that this doctor actually told his or her patient to consume this, but yet saying, get off gluten, like as if that was worse, like as if the Motrin or Advil was a safer approach. You could do something like getting off gluten would have done more, she would have had more positive changes with that compared to putting her on all of that ibuprofen.
Yeah. Oh, yeah. We completely stopped her thyroid attack just with diet and intervention, and I think some omega-3s, like, we really didn't do anything that drastic. We just stopped the ibuprofen. We did food sensitivity testing to calm down that attack and cleaned up her diet. And all of a sudden, her thyroid wasn't being attacked by her immune system anymore. It's so powerful, and people want to discount it because it seems so easy, but that's the truth.
To be gluten-free, you mean?
Yeah, exactly.
Yeah. Well, also on the other side of that, I think people think like that's impossible. What am I going to eat? I mean, what am I really going to eat? Because they're used to having like toast for breakfast or pancakes, and then a sandwich for lunch, and then dinner. I don't even know.
That was totally me. That was totally me. I thought there's no way I can live without gluten ever. Like it's not even possible. But that's all a mindset. You just need to open your mind to the possibilities. There's tons of food choices out there. And now we have gluten-free options. I didn't want to give up pizza, and I don't have to. I get to still eat pizza. You just have to make it clean. You know what I mean?
Exactly. I mean, that's one of the biggest reasons why I created my page on Instagram, because I show people everything that I eat pretty much, and to show people how easy, like how delicious and nutritious is this meal, and there's zero gluten in it. And sometimes there's also zero dairy in it too. But I think there's just such a misconception, like, pasta, I guess people would have pasta for dinner. And so they're like, well, what would I eat? Well, you wouldn't have a sandwich then with all of those nasty cold cuts, which people have like every single day. It's just not good for you, cold cuts.
Mm-hmm. I know. It's sad how misinformed we really are about what we're putting in our bodies, because I call it frankenfood. It's not real food. They took some form of real food and they manipulated the crap out of it and took all the nutritional value out of it and created the frankenfood.
Oh my gosh. Yes. Oh, and are you, so you're gluten-free now. Are you anything else? Like, are you vegan or?
I'm not vegan. I very much believe that we need animal protein. So
Yes.
I am
Same.
a strong proponent of clean. You are whatever your animal ate. So as long as your animal ate clean, the cow or the chicken or whatever, then you're probably going to be okay. But I just really try to eat clean, whole foods. I do intermittent fasting, so I tend to eat more of a keto paleo type diet. And I will eat dairy. I just don't drink cow's milk. I don't eat cow's yogurt. Or I don't eat soft cheeses most of the time, because I find that it causes me pain. It causes me brain fog. It causes me depression. And it's just not worth it at all.
No, it's not. It's not at all. Initially, when I first became gluten-free and dairy-free, I mean, I'm gluten-free now for life, but dairy-free, at least for the first year, I definitely cut it out 100%. I don't find that it affects me if I eat little bits, but if I have too much, then it will.
Mm-hmm.
I don't necessarily have pain. I'm just like uncomfortable, probably just like bloated,
Yeah. That's how I treat my patients. Like, let's test and let's see if it affects your antibody production, if it affects your inflammation markers, and see how you tolerate it, And I explain that dairy is also not tolerated for other reasons. You might not be able to digest the lactose enzyme. So it all depends. It could be the protein in the casein. It could be the sugar. There's so many reasons why you might feel like crap from dairy. So it's not always an IgG food reaction, that type of thing.
Exactly. Let's see. So let's talk just a little bit about thyroid and some of the toxins related to them.
Yeah. So when I think back to why did I develop Hashimoto's at 17-year-old at 17, I mean, there was obvious reasons, like I got pregnant. It was stressful. Who's not stressed becoming a teenage mom, you know? But I had grown up swimming a ton in very chlorinated pools. I had grown up receiving fluoride treatments at school. Every Friday they would bring around the pink swish and, we'd swish it. Sometimes I would drink it, whatever. I mean, I would get fluoride treatments at the dentist. I had all of these insults that were really, you know, competing with my iodine. So any of the halogens like chlorine and fluoride and bromine, oh my gosh, I was eating so much processed grains, a lot of cereal, a lot of bread, a lot of crackers and cookies full of bromine. All of these halogens were competing for iodine in my thyroid. And then I go and I have this teenage pregnancy, which caused me to have leaky gut, and I have autoimmune genes in my family. And there you go. I turned on my Hashimoto's, and it took me 15 years to realize that I needed to remove the triggers and turn off the inflammation. But the other big piece of it was my heavy metals and my viruses. Like I had chronic Epstein-Barr virus, and that was contributing. And I had a lot of heavy metal mercury. So I had tons of fillings in my mouth. I ate tuna fish like it was going out of style out of the cans. And my mercury level was really high. I had lead in my water because we had well water. Michigan is notorious for horrible lead in the water. And so I had to do a deep detox program to really pull out the heavy metals, the halogens, the viruses, and then my thyroid could actually function because it was no longer being attacked. It was no longer fighting for its life. So it was a long-term process of doing different things. It wasn't an overnight fix. And that's what I want women to understand is it's not that you need the right medication. It's not that Synthroid's wrong and NP is right. It's because you have to fix the attack. Otherwise, the medication is just giving your body the thyroid hormone that it needs, but it's not stopping this systemic inflammation and long-term issue. So it's
Definitely
really important to look at all that stuff. Wouldn't you agree?
Oh my gosh. That's so overlooked. It's so overlooked. It's just, this is a typical like endocrinology appointment because I've had my patients tell me this. They have left their endocrinologist and I've just managed their thyroid health. And so they'll go to their endocrinologist. I'm still feeling tired, and they'll just write them for a higher Synthroid, milligram dose. As if like that's the problem. Well, why don't we look at so many other factors that go into the thyroid? And for them, it's insane to me to see that they don't consider anything else like toxins, like you were mentioning, toxins and heavy metals. And, how often are you swimming in a pool or sitting in your like a hot tub? Because that also has all of those chemicals in there. So I'm not sure if people understand what we are talking about with these halogens, but if you look on the periodic table, iodine and chlorine and bromide are all in the same line. They're they're so chemically, molecularly similar. And so what would go into, I'm trying to explain this like in layman's term, chlorine and bromide will go into a thyroid receptor and act as if it's the thyroid, but it's not. Am I explaining it in a layman term enough that's going to make sense?
So I like to explain like T4. We think of, Synthroid is synthetic T4. T4 is the thyroid hormone our thyroid makes, and T3 is the active hormone. And T4 gets converted to T3. Well, those numbers are how many iodines are composed in that thyroid hormone. And so it takes 4 iodines to make a thyroid hormone. And those fluorides and chlorines and bromines can pretend to be iodine and disrupt that thyroid production. And so it really impairs your body's ability to make your thyroid hormone and be able to hear those signals, like you said. And so it's important to know, and that stuff's not easy to test. You can't just go out and test it really easily. So you have to sit down and take a look at your life and say, how do I live? What am I exposed to? What's my diet look like? What's going on here? And really try to make some headway that way. But I would agree with you that the endocrinologists, at least where I live, they're awful to women. I have had many patients say they left crying because they get so dismissed. And, they'll only measure TSH and free T4. And reverse T3 will tell you so much. It will tell you if those halogens are too high, if you have chronic Epstein-Barr, if you have some other autoimmune process or heavy metals interfering with thyroid hormone function. And so get your reverse T3 checked. I mean, just if you can't get your doctor to do it, find somebody else, find someone like me or Margaret. We will order that stuff.
That's so true. It's never checked. It's always this, I know everyone loves the T4 and just doing a TSH. Sometimes not even doing a T4. They're just doing a TSH. Oh no, it's fine. It's within normal. I was just talking to someone yesterday. Her thyroid was close to 4 and it was increasing. I think it went from 3.5 to 4, something to that effect. And she asked her doctor, well, this is going up. Do you think that matters? And she said, no, it's still within normal range. And that is the biggest problem.
Yep.
When you're looking at reference ranges and thinking that anything that's inside that, we're fine. And that is so wrong. It is incredibly wrong.
Yes. Conventional physicians are trained to diagnose disease. So you're not going to get any kind of intervention until you reach the levels required for diagnosis. I see it all the time with thyroid and with diabetes. Your average blood sugar, your hemoglobin A1C, it's 5.6. Well, that's 0.1 away from pre-diabetes and a few from diabetes, but do they talk about that? No, they say, you're fine, we'll see you next year. And they keep checking it until you actually have the diagnosis, and then you can have your medication. You need to look at the trends and intervene before you get the diagnosis. I can't stress that enough. You don't want to keep going down the same path. If your thyroid is going 3.5 to 4, you need to intervene because you're about to fall off the deep end, And talking about reverse T3, I want women to understand that will change your TSH level just like your T3 hormone will. And so the doctor looks at TSH, thyroid stimulating hormone from your brain, and if it's in the quote unquote normal range, they assume everything throughout your body is functioning properly. They assume that it's all just fine and dandy, but women know better because they don't feel fine. They feel like crap. And it's because there's other things at play altering that TSH level. But like you said, the reference range is also way too high, just because women's socks are shoe size 5 to 9 doesn't mean I can wear a size 9 shoe. I wear a 7. If I wear a 9, I'll be flopping all over the place and I can't get into a 5. We all have our range that works best for us, and the conventional range is outdated and it's not
horrible.
Horrible.
Yeah, it is. It really is. In functional medicine, we look at optimal ranges. We don't look at these archaic reference ranges. It really is archaic. Yeah. All right. Well, let's see. So this was amazing. This was so much information. This was So
Good.
good. Thank you so much. So why don't you tell us where people can find you?
Yeah, I would love to connect with your listeners if they need me. I'm licensed in 29 states, and you can just go to my website, drtabatha.com. It's drtabatha.com. Or you can follow me on Instagram at Your Voice, Your Health. And don't be afraid to reach out to me. I work with women all over the country, and we fix your thyroid, we fix your sex hormones, we fix your gut, because that's where it's all stemming from. And I love what I do. It's amazing.
Oh my gosh, I love that. Yes, and I follow you on Instagram and you've got lots of great information on there.
Thank you. You're awesome too. So I love that you're helping women on the East Coast where I can't help them, because we just got to all work together, right? I mean, it's a sisterhood.
Absolutely. Absolutely. All right, Tabatha, thank you so much. Thanks for sharing your wisdom with all of us today.
You are so welcome. Take care.
All right. Wasn't that an amazing conversation? I really hope that you learned as much as you could about your thyroid, about birth control pills, what it's actually doing to your body, and all the reasons why hormone replacement is actually good, except for certain situations. So if you are wanting to connect with Dr. Tabatha, links will be in my show notes. And that is all for today. Thank you so much for listening, and I will talk to you all next week. Oh, by the way, next week I have Cassandra Bodzak on the podcast, and I've got a week-long Monday, Tuesday, Thursday, Friday meditations from her. Really short and sweet, 10 minutes. Every day there's a different type of meditation, so be sure you tune in. All right, I'll talk to you soon. Bye for now.